Okay, we're going to go ahead and get started. Good afternoon, everyone. Thank you for taking the time to join us today. We have a lot to cover, and the more we cover today, the less likelihood we will need a fourth meeting added on. So we should all work really hard to get as much done as possible in today's meeting and the next two meetings so that we can cancel our fourth meeting. That's your carrot. Let's get it. With that, I'm going to turn it over to Jules just to give us some follow-up on the rundown on the follow-up from our last meeting.
Awesome. Thank you, Secretary. We have 6 committee members here today. Those in person will introduce themselves whenever they speak. Just a reminder for our committee members in person, you have to click the red microphone to make it green for you to go live. When you're done speaking, just shut that off because they're pretty sensitive. I do want to let everyone know virtually we do have quite a few public members. Some of our applicants are here, which is great to see. So first, before we jump into the show today, I did want to follow up on a couple inquiries from last meeting. So first, there was a question about the maternal and children's health presentation. I do want to let the team know that our DPH team is still looking into that with the federal government. That data was just released, so they are working to analyze that a bit more. So hopefully next meeting we'll have that. I want to let Rep. Bomback know that we did look into the opioid settlement funds a bit further. So we'll be prepared to speak to that later. And then last but not least, to jump into our agenda today, there was specific ask to have certain applicants come and speak today and answer questions from our committee members, specifically the new programs. I believe we have 6 or 7 of those. And then in addition, we have the workforce development applicants. There's 4 of those. And then we'll jump into the remaining applications. And like the Secretary, Chair Manning said, we will get as far as we can today. We have 2 more meetings. I am very confident that we can get it done in the next meeting. But they will be virtual meetings coming up as well, and we'll use them as we need. So first, I want to turn our attention to our new programs, if our committee members are okay with that, unless we have any comments, questions.
I do just want to add that we're not going to vote on the minutes from last month's meeting just because it wasn't on the agenda that was made public. So just to avoid any concerns, we will vote on those minutes at our next meeting.
Yes. Thank you, Chair. And please let me know if you have any edits or anything to that beforehand. However, we will talk about it publicly as well. So any other members? Oh, yes. Yes, and that was Mr. Fulton's ask. I do want to say before we jump into new programs, we did pull one program, Code Purple of Kent County. I'll let the Secretary speak to that a little bit more.
Yes, so obviously, if you have read the paper, it's been pretty public that Code Purple is currently under a DOJ investigation. Based upon that and that alone, we are not saying there is any wrongdoing on Code Purple's part or attributing any wrongdoing to them, but the mere fact that there is a current investigation on their use of funds prohibits us from considering them in this process. So we did pull their application.
Awesome. Thank you, Secretary. All right, so we have some new programs to jump into. I'm actually going to illustrate it on the screen here. You'll see we have 1, 2, 3, 6, it looks like. And I will say just out there, I mistakenly left Health Literacy Council of DE off, so I will be reaching out to that group. Unsure if you're on to come next meeting to speak, and I apologize for that. So let's jump into, for those of you who are here, Lydia, would you like to jump in first, or do you want me to? All right, we're gonna have Lydia. Lydia's here. You're with the Healthy Future program, is that correct? Awesome, thank you. I'm gonna pull up. Time to pull up this presentation, then we'll have Lydia introduce herself. I'll click through. Why am I not seeing it? I don't see a presentation connected to this, Lydia.
It's a link.
That's the health fund. That's our link. Here we go. Perfect. Thank you.
Yep.
All right.
Should I stand here or should I go in the middle or?
Please stop sharing. Sorry. Share. Lydia, if you could just come over here to be in screen. Thank you. Sorry. There we go. Perfect. Sorry about that.
No, you're good. Right here.
Yeah, that's perfect. Or you could sit down over here, either one. All right. Floor's yours, just if you could make sure that you're talking into that.
Hello, everyone. My name is Lydia Sarson. I am the proud executive director of Healthy Foods for Healthy Kids, and we are a nonprofit based here in Delaware with a school garden program. So we currently work with 55 schools across the state of Delaware, where nearly 24,000 students now are participating in our education cultivation program. And I'm just going to run through some of these slides because I know our time is limited here, so we can just move on. We were founded in 2008 by an incredibly brilliant woman. Her name is Dr. Thionda Manzara, who currently lives in Hockessin. She realized that there was a deep disconnect between what students were learning in their science classes and where they knew their food comes from. So she created our education cultivation program. Our mission is to inspire healthier lives by providing youth with joyful school gardening experiences and the opportunities to eat the garden fresh vegetables they've grown. And our vision is a vegetable garden in every school. And I'm going to caveat that by saying early learning, elementary and middle school, leading to generations of healthy families throughout Delaware. So what makes our program so unique is that when Dr. Manzara created it as a teacher herself, she understood the confines that teachers and administrators have within the school day and their capacity for a garden program. So she looked at what the state science standards are and paired those science standards with what we call special jobs in the garden. So every single grade in the school participates. It's integrated as part of the curriculum. So it is an equitable program. Every single student participates, all grades, all smiles. So what does this look like? Our program in a pea shell. We grow cool weather, fast growing crops so the students can actually experience a full seed to cafeteria table adventure. That means that we are not growing in the summer because we don't have the capacity for monitoring school gardens during the summer. Also, the students aren't in school and we want them to be able to see and witness and be participating in the entire process. So cool weather, fast growing crops, kale, arugula. Oh, I don't have my kale button pin is over there. Radishes, turnips are all some of the vegetables that we grow. We start planting in September. And then again in the spring, we start planting in March, and our harvests are November and December and May and June. We know that teaching these students where their food comes from in a very interactive and engaging way is not only a way for them to learn the science behind this process, but it also secretly tricks them to loving vegetables. So what does our program look like? We have carefully curated these lessons that fit the state science standards and are NGSS supported. It's a reproducible and simple framework. Every student participates and they are able to eat the vegetables of their labor up to 4 times per year in the cafeteria. Each lesson in each grade has an in-classroom lesson as well as an outdoor classroom lesson, and that equals 1 education cultivation lesson. And I have to say a big thank you to you all for supporting us in 2020 because your grant allowed us to turn our in-classroom lessons from us having to go into the classrooms and we train all of the teachers in the program to creating actual videos. So this not only takes a step away from us as far as the training goes and allows us to have more capacity, but it also allows the teachers more capacity because they have the lesson right there in front of them ready to go. It is truly a partnership with us. We are very proud to say that Springer Middle School, after nearly 20 years of partnering with us since 2006, is still growing today. And we want to be able to provide all of the support to the schools because we know that the number one reason for garden programs to fail is because of staffing. By working with Healthy Foods for Healthy Kids, we are able to partner with the schools and continue have program continuity regardless of staff and teacher turnover. And that is all part of our background, or back-end customer service, where we provide new planting maps for every single season that is changed for every school. It also, we provide seeds, we support the garden build, and any necessary additional program implementation or troubleshooting that might happen for the garden. So what does this look like? When we first partner with a school, our staff goes into the school and models the outdoor lessons for every single teacher and their class, because we know that not everybody is comfortable being outside in the garden, and we want to make sure that the asks that we have of our teachers, we're able to answer any questions and make them feel as supported as possible. The second growing season and beyond, we go into each school, meet with the grade level teams, and answer again any questions that they might have in order for their preparation for their lessons. And then for the third growing season and beyond, the school becomes what we call independent. Again, that they're not truly independent because we are providing that back-end customer service of planting kits, seeds, maps, and any troubleshooting as far for garden health. So the program starts typically with second grade. They learn about soil and soil particles. They get gloves and cultivators and really get down and dirty and prepare the garden for planting. Next, we have kindergarten and first grade. They learn about seed structure. They get trowels. They learn about planting depths and parts of the seed, and they are the ones that do the planting. Third grade learns about water systems. They will take turns hand watering for about 2 weeks until the seeds germinate. After then, our drip irrigation system will kick in. And approximately 6 weeks after planting in the fall and 8 weeks after planting in the spring is when fourth grade comes out for their special job, which is the first harvest. And then fifth grade comes out about 2 weeks later. They do the second harvest, and they also have a bonus lesson of composting where they learn about matter and ecosystem. And traditionally, the harvests are taken to nutrition services with whom we also partner. They prepare the vegetables for the entire student body to enjoy collectively in the cafeteria the next day. And that is up to 4 times per year. Go back one, please. Oh, sorry. No, oh yeah, sorry. Okay, go ahead. Yeah, sorry. This is our list of 55 partner schools. We've added 6 new schools this past year. And we have a growing wait list of over a dozen schools at the moment. The only reason why we're not able to onboard them all is simply because of funding and capacity. So our impact, we've worked with the University of Delaware to analyze not just test scores and what in science retention, which we're very proud to say went up in every single grade level. We've also analyzed the students' willingness to try the vegetables, with 85% of them trying at least one garden vegetable. And then what we're really excited about for this application is to finalize our early learning program. This is something we piloted 2 years ago now, and it has been a huge success at the Early Learning Center in Indian River. And you can see from Dr. Hickman's quote there that lettuce is now the #1 requested vegetable from her 3- and 4-year-olds, which I think is a big measure of success right there. Also, another huge measure of our success is a student at Rehoboth Elementary loudly declared that our program is cooler than Minecraft. And so if you have spoken to a 4th grader at any time recently, you'll know that it is very high praise. I skip over that, of course. This is a list of some of our current funders. And next, oh, you don't have to play this now. But I do highly encourage everyone, if you have about 4 minutes and 13 seconds, to either scan that QR code or go to our YouTube page, where Lancashire Elementary last year did a really fantastic music video of their experience of the garden. Their former assistant principal and his wife, who was also a teacher there, put together the garden song featuring Mrs. Berry's singing radishes, and it is just the cutest thing. So please take a look if you have a chance. Thank you for listening. I'm happy to answer any questions. We are really excited for this opportunity to be able to expand our program and meet the needs of the community, as well as bring this love of vegetables, science, and education to our earliest learners, because we know that the earlier that we're able to expose them to this type of healthy living habits, the sooner they will be able to pick that up and incorporate it into their own lives, leading to generations of healthier Delawareans to come.
Thank you. I'm gonna utilize my spot as chair and start with my questions. Can you pull that back? I wanted to see the slide of donors, because one of my questions. Of course. I think you went too far back. No?
Yeah, restarted on.
Oh,
There's lots of, there we go.
okay. Yeah, I just wanted to look at this because one of my questions is the Department of Agriculture involved in this? To what extent are they providing funding? Because the application said no state funds, no federal funds, no other funds, none. So I was confused when you mentioned, so.
Yes, was the application asking for this year specifically? Because it should say that we have state funds, because we do receive grant and aid.
Yeah, so it asked two things. It asked to, if you received health funds in FY24, which you did not, but then it asks if your agency is receiving funds. Does your agency receive funding from any of the following sources? State funds, none; federal funds, none; other funds, none.
So sorry about that. That has me a little confused. We just finished a USDA farm to school grant this year that was over in June. We also in 2022 received through the Department of Agriculture, especially crop walk grant, and that is finishing up next year. And we are also closing out right now the Council on Farm and Food Policy through the Delaware Department of Agriculture.
Is that the grant that's referenced in the app? Because you say in the application, we are waiting to award determination of the FY25 grant application, but I wasn't clear what grant application that was. Yeah, of course.
I would have to look what she meant. I have to look into that. That has me also.
Okay. So, we didn't talk about this at the start of and so obviously we'll be adding programs. And so that's my answer to the question.
Yeah.
I think it's a great program, fantastic. And I love to see it. Yeah, no, but I get it. But it looks like you have a lot of fun.
I think you're looking at the wrong app, Secretary. That's Health Literacy Council of Delaware.
Oh my goodness. This is under my tab 6. Is this not the one? I'm sorry. No wonder. Look at me. That was just a test. You passed. Okay. All right. I'm sorry. So this is, what tab is this on
I
there?
don't know, Sue made this one.
Okay, that's fine.
The right one. It has been. You have been.
Yes, okay.
Yes. Yeah, they do. It talks about ARPA funding.
Okay.
Yep.
Okay, okay. Woo, all right, listen, I was
about that.
as confused as you were, so I'm glad we sorted that out. Okay, so your request is for 45,000.
Yes.
That's correct, okay. And in the event you were not, because all the things I said about funding in this particular fund dwindling stand,
Yeah.
you know, that's not unchanged, but you know, and you do have those sources, so you know, do you believe you'd be able to continue the program if you didn't receive this $45,000 from this fund?
So those sources are already earmarked for other projects.
Okay,
We do have we have some funding that is through Newcastle County to support this project, but it is not fully funded. If we do not receive the funding for this opportunity, we will absolutely be continuing. We will just have to find funding elsewhere. We know that this program has real value to the community, and that's also representing the community interest that we have for it. So we'll be continuing to talk to everyone we can to figure out how.
in your request, it looks like the largest chunk is for research and design of materials, but just because it's the largest chunk, that doesn't mean it's the most important chunk. So if the committee were to give you an award that was less than what you asked for, what thing on here would you prioritize, do you think?
I would prioritize that. I would also prioritize the database associate,
Okay,
because we are really looking to expand. We believe that we can have a vegetable garden in every school, and that Delaware can be the first state in the nation. We're running the numbers right now. Out of our 55 current partner schools, 45 are public elementary schools, and that equates to about 38% of the 119 Delaware public elementary schools. So we are well on our way to it. Some of the funding in there is for an additional additional early learning center. We've had interest from the Towson Early Learning Center, as well as from Capital and Cesar Rodney school districts. So if we needed to reduce the request, I would ask for the garden build items to be reduced, because quite frankly, it's very easier to find funding for those garden builds and those types of supplies than it is for us to actually be able to dig in and finalize and formalize this program so we can bring it out to the rest.
okay, that makes sense. And my last question is, have you asked the Department of Agriculture for a $45,000 increase to cover this?
Not for this program. That was not the Department of Agriculture. The Department of Education has recently come to us and asked us to prepare a budget for 6 new gardens. We're waiting to hear if that is approved or not, but that is an elementary focus and not early learning.
Gotcha. And when will you hear from DOE, if you know? It sounds like I have to call my fellow secretaries. Okay, those were all my questions. Any other committee members have questions?
I'm sorry, just to finish that answer about the Department of Ag. We're waiting on the new specialty crop block grant to open up. That has not available yet. We're also in a current cycle for it, so I'm not sure if you would even be eligible to apply for it. Hence the reason why.
Sure. If you were eligible, would you be able to roll this request into that, do you think? You would. Okay, great. Thank you.
This is,
Go ahead, Dr. Lee, was that you?
oh yes, sorry, I have a baby with me, had a doctor's appointment. My question is about, I'm the school physician at Shoreditch. I was actually surprised to see our school's name on there because there were some people recently trying to set up a community garden at Shoreditch because it looked like our garden was abandoned. So I'm not sure if you're still currently working at Shoreditch or if this funding is what's going to be used.
That
Just
is
so I can
really
request
fantastic. Well, I'm sad that you don't know that there is a garden at Shortledge. If you're looking at this photo, right now of the current funders. You'll see there's a big group from Christiana Care. And you will see the back of Shortledge Elementary School that we rebuilt their garden last summer. We are working with the Sierra Freeman, I believe, at Shortledge to implement the program. And they are running it.
I just didn't see anything growing out there, so I'm glad to know that there is something in the works.
Well, they just planted, so please give it a few weeks yet.
Thank you.
Uh-huh.
I did have one more question. And so, this jogged my memory because I had read this before and I meant to write down this question, but I was looking at the wrong tab. The connection with the Dual Gen Center it's mentioned it at the Dual Generation Center. I am in the right one again. I'm Healthy Food for Healthy Kids. Yes. The pilot at Stubbs.
Oh, yeah.
the Dual Gen-
Yes,
yes. So obviously the Dual Generation Center is something that was a priority of the governor that DHSS has resources at and has been working on. Have you had any conversation with Helen or anybody at the Dual Gen Center or anybody at DHSS related to this?
No.
Okay.
No.
Okay.
Although we are hoping to build Stubbs Garden on November 9th. If anyone is interested, please reach out. We are still confirming that date though. But we would love to have any interested parties come and see what this looks like.
Awesome. Thank you.
Any other committee members?
I'll make a comment. First of all, I think this is a fabulous program. I really do. And I was just wondering if you try to target schools that are either in lower income neighborhoods or there's a lot of areas that are food deserts. You try to target schools in those areas and try to make up for that.
We want to work with any school who wants to work with us, but 78% of our partner schools are Title I. We really do want to bring this education to the people, the students, the community members who really need it most at first. And so to be able to provide seeds, fresh vegetables in these areas is something we are really proud of.
And I wonder, this is more of a comment than a question, because I know you said you're working with DOE, but the districts get opportunity funds for things like this, and a lot of it goes to the Title I schools. So, yeah, I think there's a lot of hopefully funding opportunities out there, because I agree. I mean, I think it's a great program, and getting kids involved in agriculture and understanding healthy foods and eating is critical. So I would love to see this.
We're really trying hard to network outreach to the districts more. Previously, when the program first started, it was apparently near impossible to get some school district support. So we have been really funding this ourselves. We had great success this past year with Christina School District, actually, who has committed funds to support the program in our school district. And so we have a meeting on Friday with Indian River School District Superintendent, just trying to see how we can get a little bit of support from them that way.
Yeah, that's great, because they do have a lot of flexibility around the use of those funds.
What I've heard, and that's what I'm hoping.
Yeah.
Awesome. Thank you, Lydia. We
Thank
appreciate
you.
it.
Thank you.
All right. Next, I'm gonna ask Dr. Walker, Deputy Director, are you available to go next for community mobile health? If you could just go up where Lydia was, yep. And make sure that microphone with the green you're talking into, yep.
I do not have a formal presentation. I'm just going to update you on the changes between last year when I presented before you, when you guys initially gave us our funds, and this year, and sort of give you that timeline and the plan of what the program does for anybody who either wasn't here last year or just to revisit the application. So the funding request for this work is to help support the mobile health units that are placed. There's one mobile health unit in each county. Every mobile health unit is manned by two healthcare workers, as well as one clinician, which is an RN, and then also a driver. These mobile health units go out to community events as well as targeted neighborhoods with SVIs greater than 0.75 at least 4 days a week. That's the goal and the intent. If you look through the application, you will see it somewhere in there, you'll see some graphs that support some of the changes that have occurred within that program. So utilizing these trailers this way post-COVID, because that's where they originally came from, was an idea that we had in order to improve access to care, specifically in populations who don't normally get screening opportunities, right? So we were looking at diabetes screening, cardiac screening. We were looking at access to HIV referrals, HIV testing, flu and COVID vaccines, as well as child-led and Narcan access. So those are some of the few services they offer on these units. So it's, like I said, HIV testing, education referral. They also do blood glucose testing, blood pressure screenings, and referrals to either the provider or the programs. They do diabetes and pre-diabetes screening, as well as education and referral to within the public health programs, as well as other clinics or depending upon what their findings are, to a provider. If we have something that they can get access through our own brick and mortar clinics, we would help get them there as well, making sure they have an appointment, making sure that if they need insurance, we work with them in order to complete their insurance applications if they don't have active Medicaid or something where they can actually pay for services if they're going to another place. Because a lot of times these individuals, they can't afford it and they can't get there. So those are the two things we're trying to close the gap on and at least give them an opportunity to screen for wellness, okay? So when we came to you last year, we had a one-time funding opportunity that we were using for fiscal year 24. The funds that this committee awarded us, we're using now for fiscal 25. So we don't have money numbers on those because that's now just recently started. I say recent, watch, it'll be at the end in no time. But, so we're asking for more funding at this time for fiscal 26. So if you look at the numbers that I gave you in the report, you will see that the numbers I gave you only go, I think, to April or May. I wanted to give you some updated figures because this team has really been working super hard to gain access to these people and to get these people some of the services they ask for. When you're looking at the screening numbers to date, as of the end of September, the diabetes and pre-diabetes screening totals are over 1,000 screens statewide. Blood sugars, those are the actual blood sugar tests, not just the screens, are over 540. Cholesterol tests over 700. Blood pressure screenings are over 1,000. Total referrals to other programs is over 1,500. That well beats our initial plan of hitting 200s, 150s, 300 numbers, and demonstrates that we have a real serious need in our communities for this work. There are opportunities with BB, Christiana Care, and Bay Health. They all have mobile health units to go out to certain community events. The only difference between us and them is we serve everyone, regardless of the ability to pay. And it even says it right on the side of our trailers now. We rebranded them, so it says access, and it talks about how we serve people who cannot pay. So it's more welcoming from my perspective. It's also the trailers are handicap accessible and they have access to a nurse right there. When you look at the application as well, I think on page 13 at the very back, that's just some short, quick feedback that we received when we've had to either send people to the hospital because their numbers were really high or they were way out of control. The clinician's there and has the ability to make that connection. We have feedback from people saying, yeah, they had a great day here today. They sent somebody to the ER because their blood sugar was off the charts. And that's really dangerous from a healthcare perspective. So because we only have one-time funding and you guys were gracious enough to fund us for FY25 for the 150, we know that these numbers are way past where we expected them to be. We're asking this time for the 200,000. like I said, I apologize for not having a presentation, but I just wanted to give you the updated numbers and things so that you had that to be able to make a decision.
Dr. Walker. So the charts and data that are in your presentation, it's December, January, February, March, April. What time frame is that? What year?
This past year.
So just December 23.
Mhm. Yes. We actually launched live last fall,
Okay.
so we're very new.
Yeah.
So it's like just barely a year old. And we launched with the funding, the one-time funding we had from the screening programs.
So did I guess what I heard you say, and I just don't want to misstate it, is that the growth, because one of my questions when I first looked at the application was that almost over 50% of the work was done in April, basically. You had this huge spike in April. Did you continue to see that level of growth
Yes,
through the summer?
yes.
Okay.
And you'll see, I have updated I have my copies, I apologize. But you'll see when the weather fares better, people come out to the units more. When the weather fares worse, we're working with CBOs, community-based organizations, to get into some of these other places or apartment complexes or senior centers and stuff to be able to provide the same service level. So building those relationships as well. So yeah, with the summer, it spiked right up because of but you'll also see the vaccination numbers obviously dropped because now we're outside of vaccine season.
Right.
So you'll see those fluctuations with time.
Okay. And my other question is more of a statement. This was not a budget request that was part of the division's budget or that was part of the department's budget. In part largely because we were not able to submit discretionary requests this year. But we were able to submit a list of sort of maybes if that were to happen, but this request was not part of that.
No, it's not. It was not. It will be next year because it's a whole new team. And now that we have a clinic manager and that group and the supervisors and all on board, they're working now that they have some numbers to come from to be able to request moving forward. So they really were looking at blanks. They really had no idea where to otherwise target those figures.
Thank you.
Definitely.
Thank you. Any other committee members have comments, questions? All right. Deputy Director, I think you are good to go. We appreciate you coming.
Thank you.
Thank you.
Thank you. And we have one more applicant in person, I believe your group. We have the Delaware Adolescents Program here. So you can go to the same spot. And we'll make sure that microphone's clicked on. Let me get my screen shared team and then we have a video and then Doris is gonna hop in for us. Your screen. Yep, thank you.
Good morning. Afternoon. Sorry, I keep doing that today.
All right. Can committee members see my screen? I can just, Representative Ballback, if you give me a head nod, if you can see my screen.
I have a blur.
That's
It's a
all
gray,
right.
it's a brown
That's
blur.
it. Yep, it's a blur. There we go.
I can see that.
Awesome.
I don't hear it though.
And committee members here? No. This might be out of my text.
And then
Go to. Go to. Share sound.
Oh, look at
Wow. Sorry, team.
that. Wow.
This is why we're not the IT person.
We are today. Thank you. All right, I'm restarting that one. I apologize.
our Dappy daughters are determined and destined to be different than what statistics and society may say they are going to be. We have made a claim on our Dappy daughters. They don't know it, but we've been praying for them. We are celebrating a group of young women that dared to say yes. They didn't know what was on the other side of yes. They didn't know what the responsibilities were regarding yes. But they said yes. They said yes to having a baby. But they said, most importantly, yes, I want to complete my education. Some of the things we had to work through in order to get to this point. So please forgive me if I lose myself. But we want to say thank God for what He has done for the miraculous thing. We are grateful. We are very grateful. And so as we state the occasion, as we put our stake in the ground that our Dappy daughters are determined and destined to be different than what statistics and society may say they are going to be.
Afternoon. Thank you so much, very much for allowing me to share with you this afternoon about the Delaware Adolescent Program Incorporated. We are here today to talk about the Healthy Futures program. As you can see, we are very excited about our young people and the work that we are doing. Dappy will be 56 years old in November, and we have been committed to serving young families from the very beginning. We are here specifically to talk about the deterrence of alcohol and tobacco use, because our young people are stressed with so many responsibilities, the people in their friends circle and themselves have exposed themselves to some of the challenges that all of us as adults seem to face, how to handle stress, how to cope. But we are asking for support as we guide them in a more healthy way so that they are not succumbing to the pressures of life by choosing tobacco and or alcohol to kind of drown out their sorrows, if you will. So we've submitted our application. We recognize that tobacco use can increase with low-income young people or low-income populations, and our young people have many challenges. Some come from broken homes, some come from addiction families, some just come from abusive environments. Some come from homes that don't have enough food. Some come from not just low income, but no income. And so again, we are here because we want to promote a healthy future for our DAPI daughters.
Thank you.
Oh, and I do want to say that because we are 56, we do have some outstanding representation of excellence. And I so want to highlight the fact that one of our DAPI daughters is someone that you already know, and she wanted me to be sure to mention her name, and that is Dr. Miller, who serves as a director clinician here. And she has been incredibly supportive and continues to grow in her desire to serve. She's come to our holiday celebration to meet with our DAPI daughters to share her own story. She's willing to volunteer to continue not only to share her story, but stand as an educated representation of success is attainable.
That is wonderful. Thank you for sharing that. And I loved the video. I thought it was great.
Thank you.
So one of my questions was was this part of your request for grant and aid this year?
This is not a part of grant and aid. This is outside.
This is outside of that request. And you currently are doing the program. This is just an expansion of that program?
Yes, this is an expansion.
Okay. So looking at the budget items that are part of that expansion, if you were in the room, you heard me talk about the fund shrinking and the sort of hurdle that is for new programs in order for us to fund them. If looking at your budget, I have a guess, but I'd like to hear from you. Is there a piece of that that you would select to be funded if the committee chose not to fund it in its entirety?
I would probably ask that we remove administrative costs and work towards everything else. We know with the times are challenging for everybody. This is a very vulnerable population that we're working with, who's already, as you heard in the video, has already accepted the responsibility of bringing on another generation. And so if we can nip in the bud the desire to even expose those little ones to alcohol and tobacco, then we want to be sure that we effectively do it. DAPI has has received trust from those families. And so if we can impart in additional training to deter them from making wrong choices, then we want to do that.
Thank you. That was my only question.
Any other committee members? I'm not seeing any. Thank you again for being here.
Jules, if I can, I just want to mention, I toured DAPI many years ago. What terrific work you guys do. Thank you so much. And I didn't chime in before. Also, Healthy Food for Healthy Kids. I was helping build their little farm at Brookside Elementary in the past year on a bitterly cold day, but doing great work. So I just want to thank both organizations for coming forward.
Thank you so much. Thank you.
Thank you again. We appreciate it. Awesome. I believe that's all our applicants of new programs in person. So we're going to move to those who are virtual. First, I did see Zach Ryan was here with the Sean Locke 24 Foundation. So I'm gonna go ahead and Zach, I'm going to promote you to a panelist. You should get a link that says accept. You could do that. I just sent it. So he is promoting himself. Awesome. Zach, it looks like you're here. So if you have video, awesome. There we go.
Yeah.
So awesome. I'm going to turn it over to you. We can hear you. Appreciate you being here.
Great. Thank you all so much for your time and consideration. So basically, the official name is the Sean Locke 24 Foundation, but you might have heard of us as SL24, Unlock the Light Foundation, or some of our physical plants, which would be Sean's House, a 24/7, 365 peer support, brave and safe space here in Newark, Delaware. And then our Sean's Room locations, which are at high schools and community centers, soon to be throughout the state. Right now, St. Mark's, Elysianum, St. George's, and the Teen Warehouse, with plans to expand into Kent and Sussex County. And our mission is threefold. It's to educate, assist, and support. We've educated over 60,000 young people. We go to schools, churches, community groups, Boy Scout troops, teams, to talk about mental health, to let people know that it's okay to not be okay, to let youth know about warning signs, risk factors. Among them that that we're seeing with young people that come through our doors and at these educational events is vaping and tobacco use, substance use, alcohol use as a coping mechanism. And obviously, in my application, we talked about healthy and unhealthy coping mechanisms. And our Peer 24 support specialists that we train here through our own training program are equipped to have the conversation where they talk about, okay, are there protective factors in your life? Are there more positive coping mechanisms that can help you get to a better end or better outcomes to that mental health challenge that you're experiencing? And so we're this application was really apropos when I received the proposal. I was really excited about it because it is something that we've seen an uptick in terms of, again, like the vaping and the usage of that in a high school parking lot before class to de-stress, before a practice, before a job. And so it's something that we definitely wanted to address. The other pieces, I mentioned the education piece, the assist piece is we provide a SL24 mental health scholarship. We know when our training stops for our peer supports and where a professional needs to come in and help. But we also, we don't charge for anything. So we also want to make sure any kind of barriers. We're open 24/7. We don't charge. In terms of professional services, if somebody is uninsured or underinsured, our mental health scholarship is there to make sure finances aren't a barrier to professional therapy services and healthcare access, which I believe is one of the dimensions of this fund is that access piece. And then support. I mentioned our peer supports. I think one of the things that I believe kind of sets us apart, being in education for 15 years in 2 different states. I think it's the access to youth. We have peers, young people that understand the challenges of young people today, that specifically understands the challenges of young people since 2020. And I think oftentimes Sean's House, Sean's Room, or one of our SL24 Speaks educational presentations is somebody's first step on a longer journey. And so any way we can make that more inviting. And I think when somebody sees somebody like them in their age range or going through the same things that they've gone through or are going through, it's really helpful to get somebody that help and get them the resources that they need. In terms of numbers, lifetime of the organization, I should say, since our founding, we've impacted over 147,000 people. And we've, particularly in the health fund application, I'm trying to amplify our efforts in that education piece of the mission. Right now we have the largest physical plant and satellite, locations in Newcastle County. We did receive, as per the application, ARPA funding and opioid abatement funding to expand resources throughout the state. I want to expand the educational resources. Currently, we're kind of moving from Newcastle County down, and doing the best we can to make sure we, reach as many young people, as many of those groups I mentioned earlier, to educate as possible. But I think, if we add some staffing and some resources to our educational program, we can hit even more schools, and even more organizations. But I would also say, I want to maybe specialize a little bit more. Chris Locke, our co-founder, he's actually out speaking right now to the University of Delaware freshmen. I was at a University of Delaware hockey game the other night, but then an international student dinner the other night. I think all the different groups I just mentioned have unique challenges, in addition to common mental health challenges that young people face. I think it's this grant, the research within it, the materials, and a person dedicated to this position, and this part of our mission can really make sure we are honing in on the specific resources that might be more available and more applicable to a certain segment of our population we serve, but also understanding the risk factors, the cultural, maybe limitations and stigmas that a certain population is facing. So I really think, again, in all those ways, we can expand the amount of impact we make. Thank you so much.
Thank you. So this is Josette speaking. I should say that every time I speak and I forget, I apologize. I want to start off by sharing that, this program, I was the cabinet secretary for the Delaware Children's Department when Sean's House was opening up. And there were skeptics. There were people who thought that it wouldn't work. There were people who thought that it was dangerous to have peers providing peer services. And I am thrilled to see how far you all have come and the work that you're doing. It's so critically important. The percentage of adolescents dealing and young adults dealing with mental health issues is staggering. And so to have this resource, I happen to know some of your peer counselors and people who have been helped by Sean's House. And I think it's just incredible. I was at a presentation. It was a volleyball event a couple weeks ago. Chris spoke and, he did his Shine the Light presentation where he asks everyone to turn their cell phone light on and stand up if they, have lost someone, if they know someone, if they have a child or whatever. And by the time you're done, of course, the entire auditorium has everyone standing and everyone has a light shining. And so it's just indicative of where we are in society and how critically important this work is. So thank you. Extend my thanks to Chris. I think it's just phenomenal, the work that you all are doing. And I'm happy to see that the naysayers were wrong when you all started this.
Agreed.
So with that said, again, for new programs, it's a challenge because this fund is shrinking and we have to really be cautious about how we're distributing our funds, where we're distributing them. So two things and you don't have to answer this specifically, but there are grant funds available in other places, particularly, I don't know if you've worked with DSAM at all on any of this, any funds they might have available, but those are opportunities to consider. But with that said, I understand the request. I think your request was conservative in what you were asking for, which I appreciate. You're not really asking for the world. It's pretty narrow and specific. But with that said, if there was a piece of it, if we were unable to fund the entire amount, if there was a piece of it that you would prioritize, what piece would that be?
I mean, of course, it's the largest piece of it, but it's that personnel, right?
Always is.
Right. And I think, in this space, the power of people, that person that we're looking to, bring on or amplify or train, I think that's what's invaluable. It's that moment where Chris is able to tell his story and all those people, light up their cell phones. Before that happens, I'm in telling my story to both teams, or actually, sorry, all the teams that were there in the Sean's room. And so, hopefully I connect to one of them. Chris connects to somebody in the audience. Maddie Way, who was the young athlete at that volleyball tournament, we were working with her prior to her talking about her anxiety. And so I think that person piece, that's maybe able to unlock that young person to be able to talk about their struggles, through their education, their experience. That's probably the most important piece for me.
And that would be with this position funds, that person to do that work?
Correct.
Okay.
Correct.
And would you, assuming you do not receive any funding, would you be able to move forward with the summit and potentially hiring this position, or would that be?
Yeah.
Okay.
It would not be a deal breaker for us. I think, for me, like the summit piece is something that I want to, continue to scale. And so similar to the education programs, Chris and I are going to hit the road no matter what. But as you probably know, Chris, and now you're getting to know me, it's never enough. There's always more people that we can reach. And so if we're able to have, instead of a half day summit, a full day, a full weekend where, our schools from all across the state are able to gather together and really have a substantive conversation, but that's kind of our goal. So.
Thank you. Those are all my questions. Again, thank you for your work in this area.
Appreciate it. Thank you.
Any other committee members?
I have to do my obligatory. So Sean's house is in the 23rd House District that I serve. Chris is a friend of many, many years. And indeed, the work they do is pioneering and incredibly meaningful, and it saves lives. And I thank them for all that they do. I love the engagement of the kids there, and I love the fact that the awareness raising that you do is incredible. And just seeing the infectious energy of everyone connected with Sean's house is awe inspiring. Thank you.
Thank you so much.
Thank you, Zach. I appreciate you. I'm gonna demote you back to an attendee, and then Jeremy Moore, I'm gonna promote you to panelist for More Than Fitness program.
Thank you so much again, everyone.
Hi, everybody. Thanks for having me on. I really appreciate it. Give me 1 second to adjust my audio because I have construction going on right outside of my window.
Of course, perfect timing.
Yeah, they were not doing it for the last hour, and now they're sawing. So, all right, cool. Yeah, first of all, I appreciate being invited. I appreciate being considered. I'm the executive director of More Than Fitness. Been around since 2018, and I'm the executive director and co-founder. So every time anybody's interested in giving us any money, I'm honored and happy to have the opportunity to sell our program. So first of all, I'd just like to ask a clarifying question. This is for FY26, correct?
That is correct.
All right, cool. So we were already granted for FY25. We just obviously haven't had the opportunity to use those funds yet. Our application is to run our summer pool program. We have a year-round school program that is a social emotional wellness curriculum that includes a number of alcohol, tobacco, and other drug prevention evidence-based programs. We use Sport and Lions Quest and Botvin, and we kind of embed them with our already existing program. This request is specifically for our pool program. I will share my screen, my little presentation that I have here. Cool. Everybody can see my screen? All right, great. Thank you. Thanks for your head nod, Mr. Bombeck. So we have an 8-acre property here in North Wilmington, right near Mount Pleasant High School. Our closest neighborhoods are Edgemore Gardens and Knollwood, which are two of the most underserved neighborhoods in this area. Our 2024 year, we were funded by ARPA to run our pool program. And we had a lot of success. So to operate the pool cost $92,000, and but we operated at about 50% last year. We had 4 local summer camps like Bellevue Community Center, West End Neighborhood House, and then other nonprofits that came out and utilized the pool. We had 6 cookouts, which were really, it was really staggering to see the number of people that came out. We trained and hired 11 lifeguards. Those were all students that are a part of my year-round program. So they're students that I work with a year. We taught 73 swim lessons. We had 296 members, which was great. And then the piece that we're most proud of is that we had 70 youth complete our prevention training, and we taught 30 lessons throughout the year. So at 1 o'clock, 5 days a week, the pool is just for adult swim, and anybody between the ages of 10 and 24 moves down to the gym where we run our prevention program, which is the same program that we run throughout the school year. We blend physical fitness and meditation in a way that makes all of the drug prevention content, the social emotional wellness content, more accessible and more available to all of our students. I guess I didn't mention, which is the most important part, which is membership to our pool is free. We target Edgemore Gardens and Knollwood, which are the 2 neighborhoods that I mentioned already, as well as Overlook Colony and the last neighborhood's name, of course, is slipping my mind right now. These are our plans for 2025. We have 169, which is bringing that pool up to 100%, so that we can bring that membership number. We're hoping to have over 450 members come through the pool this year. There are lots of benefits to having this. Like, for example, there are a lot of paid pools that are around this area, and I reached out to them at the end of last summer to ask about what the break-in numbers were in comparison to other years, and there was only 1 of the 4 pools that I reached out to that had any sort of break-in this year, and I'm hoping that that's due to the fact that we're providing access to a pool, so they don't need to break in. This property, we have been able to really put together a real tobacco, alcohol, and other drug-free campus. This summer, I a couple of times heard children telling their parents, "You can't smoke here. You have to go and stand outside of the fence," which I thought was really cool to hear. Through our barbecues, we're able to provide healthy meals. Our hope is that this year we'll be able to do some trainings to be able to get my high school students that work with me all year round to be more involved in the preparation of those meals, so that they can learn how to cook for themselves. Many of our kids, like many people who present, are living in that food desert that was mentioned earlier, that nutrition desert. And so giving them the information to be able to arm themselves to feed themselves would be wonderful. And then lastly, like, the opportunity for these kids to be in the pool, to be on our campus, and then be surrounded by physical activity, and where we're constantly, whether formally or informally, talking about how to live a life not using tobacco, alcohol, or other drugs. We have a year-round community program, which adult members of the community come and train to partake in the sort of a similar process of what the students do. And they are involved as kind of informal mentors throughout the summer. And lastly, just on a personal note, I've been connected to this property that I'm now running since I was 11 years old. I've watched the pool being used for a number of years, and having it be underused, having this whole property be underused. And this summer, the pool was really the magnet that brought this campus alive. That number of 296 members, I would say 100 and probably 90 of those members were here on a regular basis, whether it was every day or every other day. It really felt like a haven that these kids could come to, and then show up at 12 o'clock when the pool opens, and they're here until 7:30 when the bus takes them home, which is our bus. We run around to the neighborhoods and pick kids up, and then we take them back home at the end of the evening. Thank you very much for your time. I appreciate it. Yeah, I'm open to any questions.
Thank you. This is Josette. So my first question is, you are asking for about a 50% increase from what we gave last year. Can you speak to why that is?
Yeah, so we have to hire more lifeguards, more staff, so that we can expand our hours and be able to, increase the number of members. This year that we ran it, we were grossly understaffed from what our guesstimation was. And then so as we prepare for what we want to do in 2025, and then how we want to continue to expand in 2026, the majority of the increased staff.
How many more people will you be hiring?
6 more lifeguards.
Okay. And so I know you did not have your funding disbursement for FY25, but summer's over. So you made it through summer without that disbursement. So are the 169, is the 169 that you received for FY25, where's that going, I guess is my question.
Yeah, so we have some outstanding bills that we have to still pay to our pool management company. So a small portion of the FY25 money is going to go towards finishing up the end of last summer. And then the majority of the funds are going to be spent leading into the summer this year.
Okay. And I think one of the things that attracted the committee to your program was that it was really focused on alcohol, tobacco, drug prevention, and that it was an evidence-based program. So I'm interested, since it's an evidence-based program, what the enrollment was, who completed how many, enrollment completed. I'm sure there were before and after surveys since it was evidence-based. So do you have that information to share?
I don't have the survey information in front of me, but we saw 70 kids through 70 youth through the prevention curriculum. And in the summer, we use sport because it's like a day-to-day individual programs. So whether we had the kids always come on Tuesdays and Thursdays or always come on Mondays and Wednesdays, we were still able to deliver that at evidence-based numbers. And I'm surprised that I didn't include that in the application, what the data was. But now that I'm thinking about it, it was because we hadn't finished it yet when we submitted.
And honestly,
I can follow.
It's not your fault because the application asks for performance measures if you received FY24 funding and you did not receive FY24 funding. So your answers were appropriate, but if you have if you have that data and you can share it, that would be great.
Yeah, for sure. I'll email that over to the committee.
Those are my questions. Thank you.
This is Marshall. My question is about how do students register and what particular neighborhoods do you focus on for registration?
Yeah, so we send out a QR code. We put them on flyers and we run through the neighborhoods that we target are Edgemore Gardens, Millwood, Overlook Colony, and Colony North. Now I can last neighborhoods, which are the 4 underserved neighborhoods that are all either like actually within walking distance or we just go and pick them up in our van.
Any other committee members? All right. Thank you, Jeremy. We appreciate it.
Great. Thanks for your time.
Thank you. Well, you can send that data request to me if you do come up with that.
Great.
Before we jump into our next group, do you want to take a quick break or do you want to get through this next applicant real quick? We have one more. All right. We have one more new program that we're going to hear from today. It's the Behavior Risk Fact Surveillance System Survey. I have a few members from DPH that I'm going to elevate and Jeremy and Zach, there's no way to unelevate you, so you're just gonna hang here as a panelist. So feel free to turn off your camera or keep it on however you'd like. But I apologize for that and don't want you to miss out on any other meeting. So I'm gonna promote a few DPH members. Let's see. Dale should be on here. Dale is going to be leading this, I believe.
Yep, that's correct.
Awesome. I see you there. Perfect. We can hear you, so the floor is yours. And I did promote a couple of your other team members in case you need to tap into them.
Okay, and do you have the program or am I loading that?
If you could run it, that would be great. I have it available, but if you'd prefer to run it, either one. You should have the ability. There we go. Perfect. We can see that you're sharing. We just don't see the presentation quite yet. There we go. Perfect. Floor is yours.
Okay. Good afternoon. I'm Dale Goodine, Delaware Burfus Coordinator.
Sorry, Dale. If you just want to put it into presenter mode real quick, we can see your notes. Bottom right, next to where it says notes and the size of the font, you should be able to click at the bottom right of the screen. Yeah, all the way. Yep, that one right there. Click on that one.
There we go.
I think, yeah, we still see your notes on that. All right, you can go ahead.
Good afternoon. I'm Dale Goodine, Delaware Burfus Coordinator for the Division of Public Health. Thank you for the opportunity to speak to you today about our application request to help fund the Delaware Burfus survey. When Helen Arthur spoke to you on September 19, she mentioned this application during the introduction of her presentation and highlighted the use of Burfus that supports much of the data that was shared with you. In addition to the information shared with you in the last meeting, I have a few more slides to share with you to help understand the purpose of this request within the amount of time allotted. This DPH program and a new health fund application this year is a foundational and fundamental element to public health programming. There is no duplication with current programs already being funded in this instance. Much of the health information shared with you in Ms. Arthur's presentation on September 19 were based on results of the collection of Burfus survey data in Delaware. Burfus is a Centers for Disease Control and Prevention survey conducted by the Division of Public Health. Important to note is that the Burfus is the nation's premier system of health-related telephone surveys that collects data about adult U.S. residents 18 years and older regarding their health-related risk behaviors, chronic health conditions, and use of preventive services. Established in 1984, Burfus now collects data in all 50 states, as well as the District of Columbia and 3 U.S. territories. The application request is for $300,000 to pay for contractual costs to administer and collect data for the Delaware Burfus. It is important to collect this data. Information collected allows us to do the work we do in public health, statewide, and through community partners. We understand that health funds are decreasing. However, Delaware will be in a difficult situation if we can't find a way to fill the gap that is developed and continue collecting this data. This request significantly aligns with the primary purpose of these funds, as the Delaware Burfus addresses multiple categories of the Tobacco Master Settlement Agreement. Failure to collect the data compromises Delaware by not being able to execute public health programming, not only internally, but with community partners as well. It puts Delaware at a loss to be able to compete nationally with other states and potentially could jeopardize future federal funding that supports public health programming. Please know that Delaware is not alone to be in this situation. Delaware's target sample of 4,000 surveys is predominantly driven by the cost to administer the survey. This target sample of 4,000 surveys is also the CDC minimum sample size for a state of Delaware size. Several years ago, CDC provided adequate funding to fully cover the cost to administer the BRFIS. However, this is no longer the case, and each year DPH is challenged to solicit supplemental funding from other state agencies and community partners, usually in exchange to include specific interest questions in the BRFIS for these agencies and partners. These efforts are not consistent from one year to the next. Contractual costs to conduct the Delaware BRFIS have doubled in the last 6 years, where the majority of the increases have been in the last 3 years, primarily due to legislative increases in minimum wage and associated indirect and overhead costs, survey methodologies which are being passed on to states, and contractual increases coming out of the COVID pandemic. In the example here, you can see how supplemental funding is needed to conduct the BRFIS in Delaware. Failure to secure additional funding conceivably means Delaware can no longer collect this information, which, as mentioned, provides the gateway to opportunities for millions of dollars that support many of our state programs. Important to note is CDC is currently considering going to 100% cell phone sample in the future, and have been testing different pilot programs to help boost participation. Some of the challenges currently being weighed is that there's some states that are rural and they don't have adequate cell service coverage, and the fact that older populations still continue to utilize landlines. A move to 100% cell phone sample will have an effect on responses from these populations, which will most likely skew data by not being able to reach them. So why the need? The Delaware BRFIS supports not only DPH, but many other state departments, agencies, and community partners. Diabetes, heart disease, obesity, and cancer are just a few of the chronic diseases that directly affect the health and lifestyles of Delaware citizens. Information on these diseases and health risk behaviors, such as tobacco use, alcohol use, and lack of physical activity that contribute to these diseases, is collected as part of the CDC Delaware BRFIS survey. The corresponding DPH programs, such as the Tobacco Prevention and Control Program, the Physical Activity, Nutrition, and Obesity Prevention Program, or PANO, and the Comprehensive Cancer Control Program, among others, can use the information that is provided to help establish and track program and state objectives, plan programs, implement disease prevention and health promotion activities, and monitor trends such as decreases in cigarette use or increases in e-cigarette use and obesity. An illustration of how BRFIS prevalence data was used to show a decrease in adult cigarette use over the years was provided in the application as an example. In addition to some of the areas already mentioned in our earlier presentation, this is a summary of the topic areas associated with the 2025 BRFIS questionnaire developed by CDC. Those modules that contain the X are going to be asked by Delaware. As you can see, the survey collects information on a wide-ranging group of subject matter relevant to the work you all do. In summary, the Delaware BRFIS is an invaluable resource that is instrumental in planning, implementing, and evaluating health education and disease prevention programs for the public. Thank you for your time, attention, and consideration. I am available to answer any questions you may have.
Thank you. This is Josette. In your presentation, your application, excuse me, on page 7, it talks about the CDC grant estimate being $450,000, but then in the chart below, if the chart is what I'm thinking it is, the chart shows grant funding requests from 2017 up through 2024. 2024 is blank. 2023 shows $537,954. So are you anticipating a decrease in the CDC grant funding?
Yes. Yes, we are. In fact, that's what's really driving. There's some elements in the application. It's a little bit complicated. That there are some years where there are opportunities for us to solicit additional funding from CDC programs to ask specific questions on our BRFIS survey. Delaware has taken advantage of those opportunities in recent years. So that's what created the increase in our funding, CDC grant funding levels. But those opportunities don't come every year. And even if we do apply for them, there's no guarantee that we get that funding. So like this year for 2025, there are no supplemental opportunities from CDC for us to apply for additional funding. It happens to coincide with a new grant project period. And like I said, there are no guarantees that, you get that funding, even if you do apply for it. How it relates to the amount on page 7, that's an accumulation of all kinds of different miscellaneous funding. The application is asking, do I get grant funding? And there's a couple programs here within DPH that provide some very minimal funding, but that's the amount that's incorporated there. That's very inconsistent from one year to the next.
Okay, so I guess my question then is, what you have reflected in your presentation was only minusing the CDC grant of $458,000 to show a funding need of $308,000. But if you're looking at all of the other grants and funding collected, you should expect to be well over $500,000 because those grant funds have only ever increased. So if you were at 537 in 2023, I presume it went up in 2024, although that number is not listed here, that you should again expect it to go up in 2025.
But it didn't. And we received about $450,000 from CDC in this new grant project period for the current 2024. The amounts for the grant funding for 2023 and 2022 and 2021, that's for this BRFIS grant. And those increases from the 370 in 2020 have to do exactly to what I just referenced, the fact that we applied for some supplemental funding opportunities that were available to us, and we were successful in getting those. So that's why, because we were starting to already experience the shortfall in these contractual amounts that were going up. So in the last several years, we were successful in doing that. But for 2024, and at the time that this application was submitted, we didn't know the amount that we got, but we got $450,000 on the grant.
So right, I understand that's what you got from the CDC grant, but you had no other grant fundings that contributed? That was the only grant you received?
That's correct.
So, okay.
Each year, what makes it kind of complicated, and I'm not trying to create this historical perspective, there are some programs that in the past, they were able to incorporate some of their grant funding towards the BRFIS. But there's been changes here in recent years where CDC has started to restrict the use of that funding, or they've carved out or eliminated some of these programs that we were successful in getting that funding for in the past. So in addition to the increase in the contractual costs, that's what's created the situation that we're in, is that, we're banking on, in this new grant project period, each year is a new application. We're hoping that we're going to continue to see the $450,000 in the BRFIS grant funding for the next 4 additional years. But every year it's a continuing application, and that all depends upon how much money that they get, and that's how they distribute it to all the states. If you take a look at some of the funding levels going back 2020 and prior, you have to take into consideration Delaware is a small state, and So I think that in the past, and this preceded my involvement with the program here, I think that that was reflective of Delaware's size, and that, you know, other states were getting additional funding. And I've come to learn that that is somewhat of the case. So CDC has taken some efforts to try and increase the funding to try and correspond with the additional costs that every state in the country right now is kind of dealing with. So it's almost a reflection of the actions of what's taken place nationwide in states that are passing legislation to increase, you know, minimum wage, and then all the incidental costs that go along with that. This is just getting pushed out to all the states. And we utilize a contract vendor, and that's precisely what's taking place here.
Okay, yeah, I mean, it's just confusing because since 2017, you've received anywhere from $30,000 to $60,000 increases in grant funds, and then all of a sudden, and you've never gotten cut, but now in 2024, you took almost $100,000 cut.
Right.
So that's odd to me.
Like I said, it's kind of hard to explain. Like I said, from one year to the next, CDC sometimes has these opportunities to apply for these additional funds, and that's what I did, and I was successful in getting some of it. And the amounts are inconsistent depending on how many questions are involved with the module that's being solicited. And then unfortunately for this at least this first year of this new grant project period, they're not offering that supplemental funding for us to try and apply for.
Sorry, this is Lisa Moore. I'm with the Division of Public Health also, but just to put into context what he's talking about, the supplemental questions are for like COVID questions and H1N1. So they get special funding to give to the states to ask the questions. So CDC doesn't always have the funding. So that's why it's up and down. But that's the supplemental funding he's talking about for certain outbreaks or something.
Yeah, it's not the grant. It's not the CDC grant program that's providing the supplemental funding. It's other CDC programs that it could be asthma. It could be like we got involved with family planning. We got involved with the COVID questions.
So do those questions not get asked anymore if they stop funding them? Do we take those questions out?
Sometimes. They don't provide the funding every year. So if they're not providing funding, we're not going to necessarily ask the questions. I think that the last slide that I provided, we can't ask every question that they put on the questionnaire because the questionnaire would be an hour long. And we don't want it to go that long. So there's some questions that are asked on a rotational, like every 2 years or every 3 years. And for 2025, this is what the Delaware BRFIS is more than likely going to look like, at least at this point. So you notice that we're not asking all the different questions. We asked cancer survivorship questions last year. We actually asked those in even years. So the CDC kind of sets it up. There is some element of being able to choose which modules you can ask or what you don't ask. But a lot of it has to do with trying to keep it within the time frame.
No, that makes sense. And I just have one more question, then I'll move on so everybody else can ask questions. I don't want to monopolize it, but
Sure.
It looks like your contracted provider who conducts this survey, according to the application, came in at 500, I don't remember the exact number, 500 and some $1,000. That's the contract cost. When is the last time that contract was put out to RFP?
I think we are in year 2 of a 5-year potential opportunity, and we've discussed that. The only thing there is that an alternative vendor, they're charging the same amount. There's not many vendors that conduct this business here nationally, and when we went out to RFP, the bids came in. They were right on target, right on line. And we talk about this every year at the annual conference, which is where all the states meet. And so we do talk about these things.
A quick follow-up though, are they not locked in by contract to the price?
In this instance, no, they're not.
I know I said that was my last question, but I don't understand. If you did the RFP, you have a contract, you have
It,
two
it,
years.
it wasn't a fixed cost base.
The contracts are $7.
Okay. I'm gonna move on for anybody else who has questions.
Any other committee members? All right, I think we're good then. Thank you, Dale and Lisa. If you could stop sharing your screen. We're
Thank
gonna
you.
take a quick laboratory break, 5 minutes, if everyone's okay with getting back at 2:45 to kick off workforce. We have Mike Jackson here and Kent Gorey, but they're gonna speak to some workforce development programs. So we're just gonna go on a quick pause, give everyone 5 to 6 minutes, and we'll meet back here. And thank you again, Dale. All right, everyone, we're gonna start gathering to get going again. I just want to confirm it. We're gonna jump to, I want to call him Director, Jackson Mike, or sorry, where is he? Mike, oh, yeah. There we go. All right, are all committee members back? I see Representative, Mr. Patel. I'm gonna operate under the assumption that all our committee members are back behind their cameras, even though I don't see them. But I'm gonna switch it over to, we have Mike Jackson here with Del Tech Community College. I do want to point out to the committee members that he will be speaking on two different workforce development items, both the Del Tech, it's the paramedic and the nursing. So Mike, I want to turn it over to you to kick it off, and thank you for being here. We appreciate it.
Sure. Thank you for having me today. I'll start with the new nurse development program, which has been in place and supported by the Tobacco Master Settlement Agreement for the last 23 years. And this is a program that was initially started as a result of a report from the Delaware Healthcare Commission, as well as the Delaware Healthcare Association on a nursing shortage in Delaware, dating all the way back to the early 2000s. An outcome of that was that the General Assembly, the current administration at the time, as well as the community college, had agreed that funding from the Tobacco Master Settlement Agreement in its infancy would support faculty at 3 of our 4 college campuses, at Stanton, Dover, as well as Georgetown, to help address a nursing shortage that was basically on an annual basis at that time, looking to fill about 800 jobs a year. So if we fast forward to today, which, as I mentioned, this is the 23rd year that this has been supported in the current budget year, the nursing shortage itself really hasn't altered much from the original time the funding was originally put into place. Based on statistics from the state's Bureau of Labor Statistics within the Department of Labor, the state is still confronted with about requiring anywhere between retirements as well as just new nurses into the system, about 1,000 nurses a year. The support from this program is being able to produce anywhere between 300 and 400 new graduates a year. If you notice in the report, on average, out of those 300 to 400 graduates a year, approximately 90% of them are passing their national examination to be able to enter the workforce. So even though it's expanded, we haven't lost any quality of what is being produced at the college. And at this point, the program itself and the nursing demand throughout the state, the General Assembly, as well as the governor, provided an additional $1.2 million in the college's budget through a separate funding source to expand the number of faculty and to expand the number of students throughout the college to continue to address the nursing shortage. So in a nutshell, over the last 23 years, if this funding wasn't in place, there's about 4,100 nursing graduates that otherwise would not have occurred in order to address the nursing shortage throughout the state. It's a nursing shortage that continues to exist today, and one in which is seemed to be fit by the General Assembly to actually increase funding from the state's general fund to support additional cohorts. So that is basically a summary of the application. I think it would go, without saying that the college is incredibly sensitive to the demands on the committee, just listening to some of the new requests today, but also understanding the payments that are coming into the Tobacco Master Settlement Agreement are declining. I think we're agnostic in terms of where the funding comes from, but the more important part is that it does support 25 faculty as well as a very small amount of support staff to be able to run these programs at 3 separate campuses, and it is all focused on personnel costs and not operational costs outside of that.
May I?
Absolutely, go for it.
Mike, thank you. Thank you for all that you've done. I'm going to ask you to go off script and
How do you know I
share
was
some
on
insight.
script, Representative? I was
I want you to go
ad-libbing.
off that script. I think you were terrifically on script. I'm going to ask you to leave that script. As past OMB director, you know that we're struggling with, I think, $8 million a year of a annual reduction of our reserve from funding things that got switch funded out of the state budget into this fund. I think in the 2009 financial challenges. Do you have any insight, any input for this committee, this advisory committee, on what to do with OMB overriding our recommendations and taking large proportions of, we only have 12 million left. Last year, they took 8 million against our recommendations out of the reserve fund. We can only do a year and a half of that. I sort of feel like we've got the band playing on the decks of the Titanic here, with no worrying of OMB. What do you, anything you can help us with?
Well, going off script, I've always been an advocate of incrementalism, meaning when you're faced with what you know is going to happen on the horizon, whether that's 2 years or 3 years, is trying to be able to address it over time and not all in one fiscal year where it becomes a crisis. Some of your recommendations last year to the Office of Management and Budget, I felt were spot on, being able to support programs, but also pointing in a direction that you support, but looking for a more of a blended level of funding for some of these programs outside of tobacco fund, meaning the general fund. I think that's always an effective path forward.
Thank you.
Thank you, Mike. It's Josette. First of all, thanks for being here. It's always nice to see you.
Absolutely.
And I do think that's something that the committee needs to talk about is figuring out how to phase some things out, not using a blunt instrument here, but figuring out how to make that transition. So I appreciate those thoughts. My one question, I lied. I have 2 questions. What is the percentage of enrolled students that are enrolled in nursing at Del Tech, if you know? It might have been in your application, but I must have missed it if it was.
Yeah, I'll describe it this way. We produce about 1,800 graduates a year, and anywhere between 300 and 400 are related to nursing. So those same percentages would really apply to our overall enrollment.
And do you do any tracking to determine how many of them stay in Delaware to work?
So we do, but as you know, Madam Secretary, it's always driven by the number of respondents that actually respond to have it of any value. The number is definitely north of 70%, but again, it's a very low number of respondents that it would be difficult for me to kind of get behind that number to say it's an exact, forecast that has any significance.
Got it. Thank you.
Yeah.
Mike, this is Don Fulton. A couple questions. Is there any requirement that the students enrolled in the nursing program serve a year or 2 or 5 in the state of Delaware so that we can combat this nursing shortage that seems never to go away? I mean, as said, I've been involved since we started funding this program, and it seems like this nursing shortage issue is not going away. So,
correct.
What can we do to keep these students in Delaware? I guess is my question.
Well, I guess I would add to my other answer, 95% of our enrollment are Delaware residents. They come to college here, they stay here. And, there isn't obviously a requirement for, if you're a resident and you graduate from the college that you have to stay in the state in order to be able to, graduate and come here at a relatively low tuition rate. But I think it's one of just continuing to be able to provide pathways for residents to want to pursue the degree. So if you come to Delaware Technical Community College, your first 2 years can technically be covered under what is called the SEED program, which is Student Equals Excellence Degree. And as long as your minimum GPA in high school is above 2.5, you're able to come to Delaware Tech and have your first 30 credits or your first 2 years paid for tuition. That's an avenue itself. And the other piece is that the college, this funding here through the Tobacco Fund supports our associate degree programs, as well as transitioning to a registered nurse. We also run a Bachelor of Science degree in nursing as a result of demand from the hospitals to be able to meet what some of their requirements were for their accreditation purposes. So it's a long way of saying access through the SEED program, I think, promotes residents wanting to come to the college and remain in the state. And the second is a clear pathway at a relatively decent cost to a bachelor's degree for nursing.
I guess my other question would be, and I know I posed this to, you've been involved for several years, I guess, in this capacity, but I remember asking a question, and I can't remember to whom, but it basically was, will this program as it exists presently continue with or without health fund advisory funding? And the answer was yes. Is that still the case? Would you maintain these 25 positions and maintain the program, or would it suffer if, for whatever reason, you did not get funding from the health fund?
Well, I'll answer it this way. Part of our mission is to be able to meet workforce demand in the state. The state of Delaware provides approximately 50% of our operating funding in order for us as a community college to provide a tuition rate which hasn't changed in 5 years, to be able to provide an entryway for families who otherwise may not send, their child or an adult wishing to come back to pursue a degree. So my direct answer to your question is that any reduction in funding would have to also be discussed with changes in tuition policy by our board in order to continue to pay for the faculty members that are delivering the graduates that are meeting workforce demand. And I would just point back to, the most recent budget adopted by the state actually increased funding to the college specifically for nursing to expand beyond what the Tobacco Fund supported.
That's the 1.2 you
That's
mentioned earlier.
1.25 million. Yes.
Thank you.
And look, I understand the challenges that you're under of being able to have such a significant number of programs being funded with a declining source. I think at times, we're obviously made a full application based on what we see as the cost for the positions that are funded through this program, but we are sensitive to what you're dealing with.
Mr. Bolton, any other committee members on this portion? Because Mike, you didn't speak to the paramedic portion yet, correct?
No, I have not. And I'm happy to do so when the committee's ready.
It looks like our team is good to go, so you can jump into that. And if committee members have questions for the nursing portion, we'll just throw them in there too, if you don't mind.
Sure. So the Tobacco Fund also supports the paramedic instruction program at our Dover campus. And this funding is supporting 2 faculty members plus a small amount of operational costs and it's been in place for 9 years. It is supporting an associate degree in applied science. So when our students come here, it's different than a paramedic certification program. It does take, about 2 years to be able to finish. And since fiscal year 2017, it's graduated 71 graduates, where those 71 graduates, at least the last 3 years, 100% of them have passed both their written and their practical portions of the National Registry exam for paramedic instruction. And they have a job placement rate of 95% over the last 3 years. The market, right, is still in demand for paramedics. And again, we use the data that's from our state's Department of Labor, which is showing through 2030 the need to recruit nearly 100 EMTs and paramedics over the next 5 or 6 years, which is data that's been relatively consistent. And we also recognize the fact that, we have an academic program that takes a little bit longer for students to be able to work their way through to get out into the workforce. And recognizing that, there are 2 things that the college has done to be able to expand our ability to match workforce demand. The first is at our Dover campus. There is now also a certificate program. It just started in January to complement the academic program, where there was 12 students that were enrolled in that, and 10 of those students were actually sponsored by both Kent and Sussex County governments to help meet some of their workforce demands. And the second is the college is close to completing renovations at our Wilmington campus for what is called the Allied Health Center of Excellence. And included in that is expanding the paramedic instruction program to Wilmington for both a certification program as well as an associate in applied science. And the certification program at Dover, the certification program in Wilmington, as well as the expanded degree program in Wilmington are all self-funded by the college to complement the funding that is provided by the state's tobacco fund for our programming in Dover.
Thank you, Mike. We appreciate it. Do we have any questions, comments? Any members? I am seeing none. So with that, I appreciate you jumping on here. You're welcome to hang out. We are going to move over to Polytech. We have Kent Gorey with us. Kent, you can go ahead and unmute and share your video if you'd like. And the floor is yours. Awesome. Thank you.
Thank you. Thank you for your support over the years to the committee, and thanks for having me. And I would just speak a bit to the workforce part as far as my program experience. I've been with the program since it started, and recently, I would say we're seeing growth. We're seeing increased demand. We increased our capacity by 25%. In 2023, we've gone to 40 seats. And simultaneously, we have a lot more interest in the program. We had our first information session last week. We had 85 people show up. Now that's one information session out of 12 that are scheduled, and they'll probably continue on for quite a while. So I would say just in terms of interest in our program, it's higher than I've ever seen. We've had really good results over the year, consistently with our pass rates, with our completion rates, with our employment rates. And the one thing I can say is that, the employment in particular, we have students who are getting offers before they graduate. We're getting students getting multiple offers soon after they graduate. The hospitals are hiring LPN graduates because of their need to cover the unit. So this is new to us, and it sort of started with COVID. So I don't know what the relationship is there, but I think the COVID, knocked a good bit of the nursing response to the shortage. I think it, derailed it a bit with a lot of changes that weren't, that would not have been otherwise. So, yeah. I can't really explain why we're having this sort of response, but that's kind of the way things are for us. Yeah, and the funding that you provide, we have a very unique program in that it's 11 months. It allows for a certain level of accessibility that you won't find in other programs. That's what the students will tell us. We get a lot of students that are already in the workforce, maybe in the CNA or med tech capacity, and they're able to progress in their profession. We have a highly, I'm gonna say diverse, but our, underserved population percentage is really high compared probably to other schools. And we also have very limited funding channels, options. So, for example, we operate on tuition. And because we are in between a college and a high school and a 501 or 503C program, we're not really in the pool for a lot of the grant opportunities, competitive grant opportunities that degree granting institutions are. So our funding over the years, with the exception of the COVID funding, has really been tuition and this generous support from the tobacco fund. Now, we don't just use our funding for program operation, development, staffing. Those is important for that. Is also we try to participate every year and contribute with education projects for mental health, for addiction, for vaping, tobacco, and to make these presentations and events to high school students and younger, and also the persons who are affected by a lot of the health inequities that the committee tries to address. Yeah. So any question? I'll be glad for any question.
Hi, this is Josette. So this 80,500 is the same amount you received last year. And I just want to, I'm not sure if I'm clear. This request is not to necessarily fund faculty or anything related to nursing positions or getting people enrolled in the nursing program. What is listed in the application is your reaccreditation, and then it looks like some distribution of informational resources for tobacco, alcohol, and cancer prevention. Is that what these funds would be for?
Yes.
Okay.
Yes. So for us, accreditation is a requirement now in the state of Delaware, and is expensive, but it's a requirement. So it's every for us, it's every 8 years now. So it's significant for us to to incorporate in the annual cost. Yes. Yeah.
Okay, so with the 80,500 you received last year,
Yeah.
was that used for something different? I apologize, I don't have last year's application in front of me,
You
so I
know,
don't.
I don't either because I'm not in
Okay.
my office. But yes, there was I believe that and this is off the top of my head, there was some for faculty recruitment, and then there was also we did presentations for fentanyl and for vaping. Our students created like a information cart, and they took it with them when they went to health fairs. They took it with them when they went to high school CNA programs, and they did had some special presentations about fentanyl. So that was the other part of it. Yeah.
Okay, and is this amount just the shortfall from what you get from DOE and DHSS? And I don't see that you get any grant and aid.
No, we our program is funded by tuition, and our students, because of accreditation, they can apply for the FAFSA and get Pell Grant funding, which is a main source for the tuition. And the other tuition source that's I think governmentally aligned is Department of Labor. So some of our students get Department of Labor funding that helps with the tuition. But as far as for operation, it's pretty much tuition based for faculty, benefits, all that kind of stuff.
Thank you.
And Kent, this is Don Fulton. Approximately how many graduates annually come out of the program? And second,
thank you for asking. Yeah, 40 seats. We increased to 40, and so it's been 37. The first year with 40 was 37, and this year we're at 40 presently. So our aggregate over the years is 91.4% or something like that.
And what credential do the graduates receive?
They receive a diploma.
Oh.
They receive a diploma that enables them to sit for the practical nursing license exam. Also, I would say that we have most of our graduates move on, and that we have at least 80 that are RNs now or beyond. So this funding we get, it somehow grows, I think. Yeah.
This is a difficult question, I know, Kent, but is there any way of determining how many of your graduates remained in the state of Delaware?
Oh yeah, we follow our graduates because we need that information. So, in other words, we have 37 graduates. We're going to find out, where they're working, or if they're working, or if they're not working. We definitely pursue that aggressively. And I would say percentage-wise, we probably get 4 or 5 graduates every year from Maryland. And some of them, stay in Maryland. Sometimes they come, back to Delaware. We have graduates from our program that go to Maryland for their RN and then come back to work in Delaware. So it's most of them already in Delaware, working in Delaware facilities. And when they graduate, they stay in Delaware. That's the majority of them by far. Yeah.
Any other questions, comments from committee members? All right, thank you, Kent. Appreciate it.
Thank you, guys. Thank you very much.
We had one more group in our workforce, and that was Delaware State. I unfortunately wasn't able to make contact with them, so I'm going to give it another attempt after this meeting. Actually had an email bounce back from them during this meeting that I sent 24 hours ago, so I'm not sure what's going on there. We're gonna try to make contact with them. If there's not any other comments or questions from committee members on what else we're doing today, our next step will be to discuss what just happened. And I was thinking we could play around with the scenario based on that. However, if you'd prefer to just jump into talking about other applications first and then come back and make funding decisions, that's fine. Is there a pleasure of the committee member? We shared the scenario 1, which zeroed out all switch funded programs. Is there a pleasure of anyone of where we kind of want to take this conversation?
What are the other applications that we're gonna?
So the other applications were all others. We could just run through the list, as we usually do, start from the top and run down. Okay,
I would say.
all right. Mr. Fulton's suggesting we just jump into scenario 1. All right, I'm getting a nod from the secretary, so I'm gonna go ahead and share my screen. Our lovely budget team created this for us. Please let me know if you can't see. This is our scenario 1. This is our summary. So you'll see here, we got all our final numbers with our reserve balance, our projected payment, and then projected interest. You'll see scenario 1, which zeroes out all the programs that were recommended for switch funding last year. As it appears, we'll be making the same recommendation this year. However, we can still play around with that. But this summary page gives you a quick snapshot of those, the totals with that scenario. And then in here, we have it broken down by groups. I do want to mention that last year we did recommend 20% switch fund for Deltec. That is not reflected in this scenario. We definitely can consider that, but we did not reflect that in this version. So I'm going to turn it over to committee members of where you'd like to go. We can start at the top. We can bounce around. Just jump in. We have about 45 minutes, probably 40 or so minutes, 35 minutes to allow for some public comment. And I want to use this time to the best of our ability.
And I also want to share as we go through, if there are programs that maybe before you didn't think you would have a question for, but now you think you might have a question for, share that with Jules so she can reach out to them and ask them to attend one of our next meetings if necessary.
Yes. And thank you, Joseph. Thank you for jumping in on that. I do want to make a quick announcement. I've had a lot of questions from applicants on joining this meeting. Please know everything is on the public meeting calendar. When in doubt, go to the public meeting calendar and you will find all HVAC items, including the link to the meeting. However, still feel free to use me as a resource. However, that is where everything is stored and located. We upload all files there after the meeting. And then also our HVAC website will have materials from the meeting. They won't have the meeting link, but they'll have materials. So just a reminder there. And then also public comment can be submitted via email to myself. I just ask that you get it in on the day we hold the committee, so we can get that out to committee members. With that being said, I open the floor to whoever would like to jump in first.
Jules, if no one's leaping, I would like to talk on the pure high level dollar as opposed to any line item thing. Obviously I've got this little, it's Captain Ahab and the whale for me is working on the dollars and trying to have the thing not just completely go bankrupt. So I appreciate scenario 1 in which you've zeroed all the switch fund stuff. And I think that is a really important step 1. Even with that, we still would be, if we approved all the other stuff at the requested level, we still are overspending. And so I've got 2 different approaches that I looked at. One is to identify, and this is fairly arbitrary, not terribly, what I call core remaining non-switch fund things and non-core, and I define core as being tobacco and cancer. And I looked at the underlying law, and it does indeed go beyond that. The other stuff in there is all proper, but you can either look at all of them and saying they're equally valid, or you can say the tobacco and cancer stuff is more valid than the others. That's beyond my pay grade to figure out that one. But if you say you've got the core and you want to fund that at 100%, switch fund, we're doing it 0% in this scenario. What dollars remain between the expected MSA payment plus the interest? What funding could we do for those remaining non-core? And the answer is about 81%. So we could fund them, you can round it down and say 80% the non-core and 100% for the core, nothing for the switch funded. And we would be recommending spending roughly the money we take in and leave the reserve at around 12 million. So that would be what I call scenario 2. Scenario 3 says
Rep.
that
Ballbeck,
arbitrary yep.
can I just ask you a question real quick? Would that, those percentages be included on those new programs as well?
Yes, so the new ones, if they're cancer, I classify them as core. If they're not cancer, tobacco, I classify them as non-core. And again, I would use 80 or 81% for non-core and 100% of the requested amount for the core.
Thank you.
Hey, Paul,
Okay.
this is Don.
Yep.
Can I make a friendly amendment that we
Sure.
include in the switch funders list, the 20% we recommended from Del Tech last year?
Yes, I can't put that in my spreadsheet as I'm talking, but I understand that and I don't have a problem with that.
That's about 640,000.
It's not chicken feed here. Yes, I get that. The next scenario, so we'll call that this 4, is say the core, non-core, there's no real difference between them. Treat them as one. What would we have to decrease everything by to only spend what we're bringing in? And the answer is switch fund goes to 0. The other 2 go down by 8%. And we'd be able to do we do 92% of the requested amount. And we would spend the money that comes in. And the last piece is let's accept that OMB is going to disregard anything we say, or at least has that tendency to do the same thing they did last year and disregard what we say. And as Mike Jackson points out, avoid the catastrophe, but also recognize incremental. And my thought there is we cut the switch funded to 60% of their requested level this cycle. And next cycle, we cut it to 30% and we cut it to 0% the year after that. So wean them down to a glide path to 0, cut to 60 and then 30 and then 0. And what that does is that uses about 5 million of the 12 million reserve for this year. It would cut it to about 2.5 million the year after that. It would leave maybe 4 million or so at the end. At least it's got something. And that, again, if you do that, you still can view your non-core core at 81% and 100% or at 92% for each. But to me, I think I view it as we've got a few choices. Switch funding, do we want to recommend it at 0% or do we want to do a glide path? So that's question number 1. And I think if we're having it other than 0%, we need to decide how much of the reserve we're willing to use up in our recommendation for fiscal 26 for the switch funding funds. The second is, do we want to have a distinguishment between non-core and core and fund core at 100% and non-core at whatever's left of the money that comes in? And is that a reduction of 19% if we do it that way? Or do we want to treat core and non-core as they're all qualified, put them all at the same percent and the same reduction, which would come out about 8%. Again, I'm not looking at any of the individual programs, and I've said I love these organizations. I'm just looking at having the thing not go bankrupt or not have to make draconian cuts in fiscal 27, which we will have to do if we can't make recommendations, and frankly, recommendations that OMB doesn't disregard for this year. So I rambled for a bit. I can put stuff up on the screen, but I'm not sure if I can, but it means stuff to me because I know the formulas in Excel, but I'm not sure it would speak to the committee members. Either way is fine.
Ballbeck, appreciate the initiative to do all this, and I definitely see the value, especially in that incremental decrease. I did want to point out, I want to make sure that we're taking into account the program evaluation section. I know when the secretary and I were reviewing, there was AIDS Delaware didn't include supporting information from their fiscal year 24 money that they did receive. So we definitely, at least in our discussions, the secretary and myself, definitely valuing complete applications. Because in our eyes, we were messaging, if your application is not complete, that's gonna impact your funding. So I definitely agree to these or see the validity in the core and non-core. I just want to make sure that we're using the application that we've revamped in the ways that it was intended as well, looking at things closer. So maybe we can look at that level as well and also work it into this, but I do want to make sure we consider that. So I did want to ask if any others noticed some incomplete applications such as AIDS Delaware, like I did, in the sense that we didn't get that information we were asking for of measurables, outcomes.
So I mean, Rep. Bombeck, I agree with you. I mean, I do like the idea of the incremental decrease and doing the switch funding that way. I think that's smart. I also personally agree that if we do have to cut programs or if we do have to cut funding, we should look at what the core of what this fund was funded by and developed to prevent as a priority. I don't think we have to be exclusively that, but I think those programs should maybe get a little more priority where there is a direct connection. But as everyone knows, it is permissible to have other health-related projects and programs funded by this fund. Mm-hmm. So I wouldn't be comfortable with a bright line rule, but I would definitely be fine with saying, they should get some priority if it's a direct connect, particularly as our fund dwindles. But I do, and I know this may not be popular, but I do think it's important for us to go through each application and evaluate each application because we are awarding funding and we need to be careful about who we're awarding it to and what they're doing with the funding. And if we gave them funding in the past and they're not meeting the measurements and they can't demonstrate that they've used it appropriately, we should not be giving them funding again. So I know it's a tedious process, but my expectation is that everybody has reviewed these applications and so we can discuss them substantively and make determinations about whether or not we want our names on an award, because that's what it comes down to. So I really want to make sure we're not just lump summing things and saying, let's approve all the cancer ones. And I know that's not what you were saying, Representative. I'm just saying this for the good of the group. I want to make sure that we go through each application and that we're careful about what we're approving and what we're not approving. And as important as getting to the amounts are and keeping our reserve, I think it's as important to make sure we're vetting the applications thoroughly.
Yeah, a couple of the applications. One, DSU is a great institution, and I'm sure they're doing wonderful things with their nursing program, and the president's a friend of mine. But if they don't respond, and Jules, that's going to be maybe your responsibility at this point. I think we really can't consider them if they're not willing to respond. So I'm disappointed that they didn't. But I would encourage you to try to get some kind of response from them.
I definitely agree there is a concern, but I understand HBCUs and how there can be turnover. So I hope that as a board, we take our concerted effort to make sure that we're reaching out to people, because it's not unlike under-resourced institutions for staff to be turnover, for that to be a high turnover. So I'm not okay with completely disregarding them if we have not done our due diligence to reach out to other people in the department that may be affiliated with the program as well. But thank you.
No, we will make every effort to make sure they are aware. We're not going to just rely on the email. We will reach out, and but at that point, if we don't get a response or they're not interested in coming, then that's their decision.
Yeah.
Okay. another program, this is with all due respect, because I know that statistics and data are critical. I'm just not convinced that the Delaware Behavioral Risk Factor Survey should even be included in this. And I still have questions about their funding, which disturbs me a little bit. So unless the rest of the committee disagrees, I'd recommend we don't fund that program this year.
There's a recommendation to not fund the Burfees survey that was presented by the Division of Public Health. Is there a second?
I'll second that.
Thank you, Representative. As it is a division under DHSS, I will abstain from the vote. But can I get a vote from the committee members as to whether or not we want to deny that application?
Libbs abstaining as well.
All right, I'm gonna run through real quick. Representative Bomback, he seconded that, so. And then Marshall, Dr. Lee is gonna abstain. Mr. Patel?
Yes.
That's the only ones we have on. Ms. Massa?
I'd like to abstain as well, as I am part of the Healthcare Commission, which is under DHSS.
Mr. Fulton?
Yes.
So that's 3 yes. All right. I don't know. Is it Carrie?
Yeah, there's no
Objection?
I think it's.
All right. All right, so I zeroed that one out. Any other thoughts on these new programs?
I'm not happy that we don't have a little bit more support and data for some of them. So I definitely want to spend more time reviewing the applications in detail.
Sorry, can you repeat that, Dr. Lee? What was that program that you referenced?
I wish that we had a little bit more support and data for these programs, but right now I don't have a recommendation for exactly which ones to zero out.
Okay. All right.
This is Perry Patel. I also wanted to share with you, I don't know, we get a chance to talk about the opiates and the POSDC funding, and some of these programs could have the opportunity to go there as we have sizable dollars there.
Yeah, so I think you raise a great point. And that was, some of my questions were targeted at that with some of the folks who presented today. You know, there are other opportunities for funding, whether it's the opioid fund, whether it's another state agency, whether it's other grants, whether it's grant and aid. And what we definitely don't want to do is take our precious resources and give them to someone who isn't going to need them. It's not to say they couldn't use them or put them to good use, but we really need to focus on true need. And I do think that there are opportunities for funding for some of these folks that may not exist for others. So, I do think that's an important question to consider as we evaluate these. So, go ahead. Sorry.
May I? No. I guess I'm uncomfortable / would like to avoid subjective decisions. I prefer objective decisions. And I wonder, can there be objective analysis of level of completion of an application, or including all the requested and required materials is one issue, is one thing that you can get an objective quote grade on. And the same thing for that the need is, and the inability without this to meet their goals. Is there a way to objectively get that also? Is that possible? Sort of like rubrics for grading a test for at a college or something. Is that possible, or I just feel like reading through the applications, it's hard not to only be able to do a subjective take on each application. And that feels like you get a substandard outcome.
So I think, and look, I was new to this as of last year. So what I saw was we had a new application that had some new things in it, some new measures, some opportunity to do that, right? To look at something objectively and say, based on the data you've provided, based on the measures you've provided, we should or shouldn't fund this. What was lacking was sort of like you said, the rubric, right? When we do an RFP, we have a score sheet and we go through and people get scored on different things in different parts of that RFP. So it's a little more objective. Now, how you score them is still a little subjective, right? But, which is why you have a panel. And so, I think, and we talked about this at some of the meetings last year about talking about developing it or refining it. And I don't think we ever got around to it because of the other work that we were doing. So the short answer is, we don't have that tool. I think it's a good idea. It would be great if we finished this work early, that maybe we develop that for the next round, because I do think it would be useful to have that in place. In the absence of it, I think as the committee, we have really no choice but to sort of weigh in and do it. There's no way for us at this point to come up with that. Like you said, Representative, other than the objective, you didn't finish your application, you didn't show up for the presentation we asked you to show, those things are clear, right? But the other things where it comes down to, should we fund this or should we not? Unfortunately, we've been charged with making those decisions, and they're going to be somewhat subjective, and it's going to be hard to avoid in some ways because they're very different. These programs are not, at least when you're doing an RFP, you're RFPing for the same service. So it's easy to score it objectively because you're comparing the same service. These are very different services. And so it's going to be challenging to be objective completely. So as much as I agree with you, I would love if we had some objective tool that could just spit out the best programs that give us the best return on our investment.
Mm-hmm.
We don't have it.
You have me.
We have tools. So, I do think there is going to be some subjectivity, which is why, I think it's critically important to review the applications and for everyone to have an opinion, and for everyone to bring to the table their opinion, because hopefully we all don't agree, right? I mean, that's how we get to the best results, is if we all have different perspectives and can debate it and talk about it. I know that's not the answer you wanted to hear, but that's kind of where I'm at.
I think it made an awful lot of sense. And I'm fine with the, we're not where we want to be. Let's work with what we have here, and then let's work towards where we want to be before the next cycle. That's a great statement. I appreciate that.
So, do we
there-
think, since we did a deeper dive on some of the presentation, the folks who presented today and their applications, is it worth sort of talking about them on the merits, and whether we actually get into dollar amount funding? Because I understand that's something that might come down the road as far as, what we have left over after we cut make recommendations for switch funding. So we might not get to a dollar amount today, but could we at least get to a point where we say, yeah, we like this program, we want to try something with this program, but we don't want to fund the whole thing. Like, just maybe get somewhere on some of these.
I agree.
Maybe. I mean, is it fair to say on Dell Tech that we're going to put them in the switch fund pile? Nobody is suggesting that they be cut.
No.
Do you want to switch from them 20%? Is that what that's
That
what we
was
did
my
last-
recommendation in the fall.
That's what we did last year. Is that what? And would that be, it looks like last year we just did 20% for the new nurse development. Did we want to do 20% for the paramedic as well? And you can see here, the new number reflected with 20% switch funding. And then this one would be,
I would say yes. I mean, obviously, the state recognizes the value of the program. They gave them another 1.2. And, frankly, that's where the shortfall should come from, in my opinion.
perfect. So I've updated that. Have both of them switch fund at 20%. You'll see the new totals here. All right. What about our Polytech program that came to speak? Any thoughts there?
I really like that program. I think it's a great program. I think the Polytech program is just, it's reaching a population that none of these other programs want to reach. It's doing some really good things. The dollar commitment to it is limited. They seem to be doing a lot on their end to facilitate the program. I like to fully fund that because I think it's a great program.
Thank you, Mr. Fulton. Our committee members in agreement with that? Awesome. I'm seeing a head nod from Representative Baumbach. Any other thoughts? All right.
Jules, by switch fund 20%, you mean reduction to 80% of the requested amount, right? And it's
yes.
Is the term switch fund because that there's an implicit DHSS will be asked to pick up the other 20%, or I'm not sure why switch fund phrase is being used for that line.
Oh, I think this is a great time to come up with a different terminology because we've definitely used switch funded interchangeably from switch fund originally, and Mr. Fulton, correct me if I'm wrong, comes from those programs. So we're switched from the general to us back in 09-08. Right. However, along the way, we've recommended switching funds from HVAC to the general fund. However, they were not lumped in as a switch fund. However, we are using interchangeably. So maybe not switch fund, but recommend general fund.
Or perhaps we don't
Maybe
need
it's
that. We can just recommend that we fund those programs at an 80%.
Funded 80%, right?
Thank you. Yes. And keep me straight with that terminology because I do think there's been some confusion on what programs come from that 08-09 switch fund versus just ones that ended up in tobacco and really shouldn't be in tobacco.
And Jules, I think we have enough problem with those darn legislators having this advisory council tell them what to do. So just say funded at 80%. It's probably a better way to go.
Well said. All right, perfect. So I want to ask again, does anyone have any other comments on this new program, the new programs we heard from today? And if you don't, but think of something, please bring it up next meeting.
So I have lots of comments.
I see it.
You see it. I'll just run through them and I'm going to make comments and on some of these, I'll just make my comments and do with them what you will. So for the Healthy Foods program, my comments were I like the program. However, I do think they have other funding sources that they could tap into. And were we to decide as a group that that was something we wanted to do, we should do it at a reduced amount. As for the community mobile health, should I abstain? Should I not give my opinion? Well, stop voting. So I'm just giving my opinion.
Yes.
That was a no for me. I believe there's other funding for that as well. Sorry, Becky. For DAPI, that was another area where, again, I really liked. First of all, I loved all these. They really are important programming. This is not about the importance of the program or the validity of the program. It's really about how the state can fund these things. So, with community community mobile health, I fully support that. I think it's incredible. I just don't know that this is where that should be funded. And I feel the same way with DAPI. And I just had a question mark on that one because one of the comments was that they would still be able to do it without the funding. So if that's the case, is that one we want to prioritize over others that couldn't do it without the funding? Same thing with the, I put the Sean Locke Foundation, that's not what it's called, but the 24, what is it? What do they have themselves named as? I'm sorry. 24, yes. Sorry. Obviously, you know, look, I'm a huge supporter of that foundation. I think it's amazing. I think their request was small and targeted. But, you know, again, they have a lot of funding resources that are available to them. So these aren't no's for me. These are, do they have other opportunities, other places they can get funding, and should we be the ones funding them? And one of those big opportunities is grant and aid for some of these folks. So keep that in mind. More Than Fitness, significant increase when we haven't really seen what they've done with the funding we gave them for this year. That's no fault of theirs. We didn't give it to them yet. So that's a concern for me. That we would be giving them an increase without having any performance measures or data on that. Now, if that's one we would hold for the data, because he did say he would send us the data that he had from the summer, because again, I thought the draw, although I'm a big proponent of keeping kids busy in the summer in and of itself being prevention, the draw for this group was that it was a tobacco evidence-based prevention program. So I'd be interested in seeing that data. The Burfies we decided, and Deltec we decided, and Polytech we decided. So those are my thoughts.
Anyone else have thoughts before we need to move to public comment in about 5 minutes or so?
I tend to agree with most of them because they do have the abilities to knock on somebody's doors. For example, the healthy food, there are plenty of Department of Agriculture funding that's available. I'm not knocking one. They're all good programs. It's just, do they fit into the charge that we have, which is for the tobacco funds?
Is there, is it, geez, I'm just the mean old finance person looking at this stuff, but are we not at the point where we want to say that we would not entertain increases to any line? Given that our income's going down, one can argue that it's inconsistent to be giving boosts. And I'm just looking.
I personally agree with it.
Health Literacy Council is an example.
Yeah, I mean, look, I agree with that. I think increases at this point when the fund is shrinking is not really the best course of action. So I could agree with that. I think that poses the same hurdle for new programs, right? I mean, we have other programs that we've committed to. So without a reason to cut those programs, I would be inclined to fund those first before we take on new programs.
I think that probably would be perceived better by the general population, that not only we hold back, but we also cut back the new programs because our funding is dwindling.
Okay, so just to be clear, I'm sorry, Don, did you want to?
I'm just, and I always sound self-serving here a little bit. I just wanted to remind the committee that we are funding the Innovation Fund, which in turn supported 78 projects that likely would not have been funded had we not allocated money to the Innovation Fund. So I know that I struggle with encouraging new programs every year, but I can resolve it in my own mind knowing that we're doing that and doing it extremely well with kind of some side money.
then I tend to agree with you, Don. The real question I have is, I hope you and I started this back in the days, and I hope we have put some seed money out there that hopefully now we are in a position to see if it could generate its own legs and walk. And we could discuss that in detail, but again, I know we created this. It has a lot of momentum. We made a lot of progress. Just don't know whether there is somebody else who could take the ball and run with it.
Okay, so what I'm hearing is two things. Let's take them one at a time, just in case there's disagreement. The first thing I'm hearing is we do not want to give increases this year to existing programs. Does everyone agree with that?
Yes.
Yes.
Anyone disagree? Great. Okay. The second thing I'm hearing is that we are not going to entertain new programs, and I'll put a caveat on it, unless we have some surplus after we go through the process of evaluating our current programs.
Makes sense.
Does anybody disagree?
Do you see a value in having room for exceptions if the group agrees?
Oh yeah, I mean, I think listen, it's the group's decision, right? So if somebody comes back and says, I feel really strongly, after we've, kind of gone through our process, I feel really strongly about this group or that group, I mean, we can certainly bring that back to the table. I'm just trying to get us to make a dent and move forward a little bit. But yes, no, nothing is final till it's final.
So it's a guideline that we would expect to apply almost completely to the new programs.
Yes.
I also feel comfortable with knowing more about the Innovation Fund, connecting potentially those programs to the Innovation Fund. I know they do a good job of understanding the local demographics and local needs. And if those programs have substantive merit, I think that those may be worthwhile programs that are funded by the Innovation Program. So I also feel comfortable with that approach, with possibly not funding new programs unless we have a strong data to support them.
Yes, and we can redistribute that, the report on the Innovation Fund as well, so people can have that. And then we can discuss it and people can ask questions about that. And also, I know, just a reminder, I think our timing is really good because, I mean, it's good and bad, I know, but it's good in the sense that we make these decisions in the fall. That gives folks plenty of time to prepare for their grant and aid presentation, because many of these folks, particularly new programs, already do receive grant and aid. So it could be the basis of their increase could be that they did not get this funding, right? So the timing is pretty good for that. Okay.
I have one thing I'd like to get to before we go to public comment. Is this the time?
Yep.
Okay, in the bill that established this advisory council, it includes the following statement. Expenditures from the Delaware Health Fund shall not be used to supplant any state expenditures appropriated in fiscal year 1999 for purposes consistent with those outlined in this section, subsection C of this section. So it says this was set up to not switch fund from the 1999 state budget. Can that be explored, and specifically to see, I think many of the things that were switch funded in 2009, they were marked as switch funds, came up after 1999, but can that be verified to make sure that we are not currently funding or receiving requests from things that were in the 1999 budget, and therefore make sure we're not violating our establishment legislation?
Yeah, I mean, we can talk to our DAG about that and look into that further. Because I don't know what the interplay would be between that and epilogue language, because that gets voted on as well. So can the epilogue language supplant it? And what is the impact of that? But we can certainly look into that.
Thank you.
Mm-hmm. Awesome. Thank you, committee members.
I'll just say one other thing. Today reinforced for me the value of having program presentations to this committee. And I think we should, as a goal moving forward, if we don't hear from everyone, at least maybe a third of them, and then the next year we do another third and so forth. This to me was very valuable. Hearing from the people, hearing their passion, understanding more about the projects and programs. So if we can make it a point to incorporate this moving forward, I think that'd be.
I agree with that, Mr. Fulton. It's very informative for making more decisions with information. Yeah. With that being said, we'll probably continue discussions the next meeting, potentially 2 meetings on just HVAC in general, because a lot of those concerns also come from the timeline we're on. That we're fitting these meetings into the fall, and we have to get about availability around holidays and quorum and all that. So everyone can put their thinking caps on in this break before we come to the next meeting, and maybe we come up with some creative ways to get that information from committee members next year, or members next year. With that being said, I'm gonna
Just one other thing.
Yeah.
Sorry.
Go ahead.
Madam Secretary, do you want to comment at all on the Joel settlement? Or not?
So as far as, I mean, that
Because
funding.
I think that came up last.
Yeah, so the Joel settlement funds go back to the Consumer Protection Unit at the Department of Justice. So we do not have access to those funds. They don't fund programs. They're used for funding that unit, whatever work that unit needs to do to keep our consumers safe. So we do not have access to those funds. Thank you.
Thank you, Secretary. All right, I'm going to move on to public comment. If you would like to give public comment and you're participating virtually, please raise your hand, and I'll give you the availability to speak. Otherwise, in person, I have Lydia signed up for public comment. Would you still like to give public comment? No, it's okay. You're good. Hold on one second. Let me get your microphone real quick. Here you go. Thank you.
Sorry, I guess I was a little confused by that sign-up sheet. But just 2 quick clarifying statements regarding our list of funders that we had there, and also the program in and of itself. Those lists of funders are donors who have donated at least $1,000 or more, because we are really trying to drive community engagement and activism within our organization. And that includes an Adopt a Garden program where we're reaching out to corporate sponsors to try and adopt their local school garden and have a volunteer component that would be supporting the school. So it's not like those list of names are all grantors and very serious funders. The other note I would like to make is that while the early learning program is theoretically, I guess, new to this organization as far as the funding, it is an extension of our current education cultivation program. So it's not technically new, it's just an expansion.
Thank you, Lydia. All righty, real quick, let me make it back to my desk. It looks like we have 2 individuals signed up for public comment. Nicole and Alex, I'm gonna give you promote to panelists so you can speak, both of you. And I do ask if anyone has copies of public comment that you can share with me, that would be amazing. All right, Nicole, you can go ahead once you're available.
Thank you. Thank you. I'm speaking on behalf of Cancer Support Community Delaware. Thank you to the Health Fund for your continued support and commitment to the mission of the fund. Cancer Support Community Delaware, CSCDE, has been constantly and effectively providing programming for cancer patients and their loved ones across the state of Delaware for over 28 years. Our reach has grown significantly over the past 4 years as we have implemented virtual and hybrid options for all support groups and programs in response to the need for more mental health support through the COVID pandemic and beyond. We have shown ourselves to be consistent in fulfilling our mission while adapting to the needs around us. Statewide statistics show an increase in incidence rates of many cancers in Delaware, including many diagnosed at younger ages with more aggressive or advanced stages. Fortunately, with good treatment, many may live longer after a cancer diagnosis. However, those individuals still deal with a myriad of health issues. The burden of care falls on our medical system, which often fails to address tangible, practical interventions that improve quality of life. While other organizations may provide occasional seminars or exercise classes, no one in Delaware provides a place for those suffering from cancer to engage in multifaceted programs on a regular basis as CSCDE does. Since opening our doors, we have always provided professionally led support groups, healthy lifestyle classes taught by trained professionals, educational sessions with experts in their field, and social programs, all at absolutely no cost to the patient, caregiver, and loved ones in our state. In 2019, we served 1,100 participants. Since 2020, we have served over 36,000 patients, caregivers, and loved ones, serving 6,600 of these in 2023. So to give you an idea of the programming across our state of Delaware, we have 5 weekly support groups for cancer patients, 4 weekly support groups for caregivers, 10 monthly cancer-specific groups, including breast, lung, colorectal, prostate, and young adult, 3 locations with weekly gentle yoga classes, 3 locations with chair yoga, 3 locations with Tai Chi, weekly meditation, sound meditation, poetry and writing, regular meditation, sound therapy classes, monthly art therapy classes, monthly education with relevant topics, and social groups for men, knitters, and a book club, and 3 locations with Walking Warriors, a walking group. We're very grateful to the Delaware Health Fund for providing us with the much needed funding to enhance, increase, specialize, and publicize our cancer support programs for all people in Delaware who are impacted by cancer. CSCDE has worked continuously over the past 10 years to make sure our organization is debt-free while evolving and growing our community partnerships and fundraising throughout the state. While funding from the Delaware Health Fund is now a much smaller percentage of our annually increasing budget, continued funding from the Delaware Health Fund is imperative for Cancer Support Community Delaware to be able to continue to provide the number and quality of statewide cancer support services. We look forward to a long, productive, mutually agreeable collaboration to assist those diagnosed and living with cancer. Thank you.
Thank you, Nicole. Alex, you can go ahead.
Thank you.
Thanks so much. Good afternoon. Thank you for the opportunity to make some comments. My name is Alex Kasper. I'm the Director of Advocacy for the American Lung Association. We appreciate the committee's thoughtfulness and strategic approach to recommending allocations for the Health Fund. We know that there are many important programs funded through the Health Fund and difficult decisions are made throughout the process. We encourage the committee to continue to support and prioritize funding for tobacco prevention and cancer programs, which was the original intent of the Master Settlement and Health Fund. These funds are integral in ensuring that Delaware continues to stay healthy and tobacco-free and combat new and emerging products that are attracting and addicting our youth. We thank you again for the commitment to the Health Fund process and the opportunity to make comments.
Thank you, Alex. And I just wanted to pop back over. I'm sorry, Sarah, I missed you for public comment in person from the University of Delaware. You can go ahead and live your mic and comment.
Hi, everyone. I will be submitting my full public comment in consideration of the time in writing, but just to highlight a few things. My name is Sarah Mallory, and along with the program director, Alicia Fletcher, we lead the Delaware Network for Excellence in Autism, or DNEA. We provide training and technical assistance and information dissemination that benefits individuals with autism, their families, and the professionals that serve them. Listening to your conversation around impact, I wanted to take a moment and really just highlight the return on your investment and health funds and how we've been using them to impact the health and well-being of Delaware families who have individuals with autism in their family. Using funds that we received from the Health Fund Advisory Committee, the DNEA touched the lives of over 14,000 Delawareans our last fiscal year. This included 2,284 Delaware professionals to whom we provided live training, 9,316 points of contact in which we disseminated evidence-based practice guides, training tutorials, videos, and other learning materials, and then 2,656 individual client support contracts statewide last year. This is almost 4,000 more people than we connected with when I was standing here just a year ago. And it's not just limited to our numbers. Our success is measured by training respondents, saying 97% said that they were highly satisfied with our training, and between 96 and 98%, depending on the knowledge score, reported knowledge gain at the completion of participating in our learning activities. Individuals with autism experience significant health disparities, and we're working hard to address those. And I look forward to sharing more in my written comment. Thank you.
All right, looks like we had one more person sign up for public comment. Lance, I'm gonna allow you to speak. So you should be able to unmute now.
Very much. For the record, my name is Lance Kilpatrick. I am the Government Relations Director for the American Cancer Society Cancer Action Network. I know it's been a long day, so I just want to say that I want to echo the comments made by Nicole and Alex regarding the work of the advisory committee and the commitment to fighting cancer and tobacco in this great state of Delaware. The state has been a leader throughout the country on these issues, and please, I strongly encourage the advisory committee to continue that lead as we move forward into the next fiscal year. Thank you.
Thank you, Lance. That concludes public comment. Our next meeting is, let me pull it up, October 29th, 2 to 5 p.m., also virtual and in-person option. I will see you all then. You go ahead and close out, Secretary.
Thank you, everyone. Enjoy the rest of your day.